It's Mark again. It's 2 days before the surgery. Just want to give it a little update of what I had to do, or what I have done to prepare for the surgery. Prior to having the surgery with Dr. Radaman, I had a pre-op medical clearance, including lab work, a chest x-ray. I went to his office the following week, which was 1 week before the surgery. I had another x-ray of my hip, so we have something up to date, so the measurements can be taken obviously for the surgery. There's also pre-op preparations at the hospital over at Florida Hospital Wesley Chapel, which is where I had the surgery. You have blood work for type and cross in case you need a blood transfusion, which is unusual, but you can lose up to about a pint of blood during the procedure, so they want to have that prepared for you. You also get a nasal swab for MRSA testing to be sure that you don't need to be given any antibiotic beforehand. What I did in preparation, there were several other things. A couple of days ago, I made sure my toenails were cut, being that I'm not sure I'll be able to do that for the next month at least. Went to the dentist a couple of weeks ago. I will need to have antibiotics prior to going to the dentist, being that there's metallic foreign body. American Dental Association recommends 2 years. I'll follow up on that. But just making sure your gums and everything are taken care of, so that's not an issue. Make sure that there weren't any other dental issues that need to be taken care of, because for the first 3 months I don't plan on visiting the dentist. Other things I did in preparation around the house, even though I was told I won't need it, I do have a toilet riser. I do have an elongated shoehorn, a picker-upper in case I can't pick things up. I think that's helpful. Pressure stockings, I'm not sure I will definitely need it, but it's likely, being that having a lot of swelling in the leg, it should be fairly common, being that there's a lot of trauma during the surgery that's going on. So having actually there's a little device that one can use to help load the pressure stocking on its little metal contraption. Then you can just slip your leg in. It's easy to put the pressure dressing on, and obviously I won't be able to put it on, but I guess one of the most important things that anyone could have is someone who can help you. Fortunately, I have a lovely wife, beautiful wife, who's going to be looking after me. And actually, that's one thing I think everyone needs to think about. As I said the other day, I'm not really concerned about the surgery. I know I have a well-qualified, very capable surgeon, but I feel my wife is probably going to take the brunt of everything. She's going to have to help out quite a bit, and it's a big imposition on her, but having someone to help it's very important. As I said, I'd also done a lot of research and reading, and it's quite obvious to me that there are a lot of people that have a lot of different opinions about a lot of the things pre-op, post-op that need to be done. As far as my instructions, I know that, well, a lot of the post-op instructions generated from what people had experience with total hip replacements, but there's more leeway with a hip resurfacing. Rather than a 90-degree limitation of range of motion, mine will be 120 degrees. And even though I've gotten paperwork and spoke with Dr. Radaman, and it's hard to keep up to date with all the paperwork because some of them are contradictory, whether you're going to shower 7 days after, 5 days after, and actually now you have a covering. It's not Tegaderm, I've got the name of it, but it's a waterproof dressing so that you can actually shower, and I was told I can shower even the day after if I so desired. You don't want direct water hitting the covering, but it is a waterproof covering that should stay in place regardless. Whenever you have an open wound, you do need to keep that dry I'll say at least 5 days to make sure that it's a closed wound. My main concerns actually aren't the surgery, it's post-op infection, which you have no control over, even though everything is done to the greatest precaution to prevent infection, and deep venous thrombosis. So I will be on a blood thinner. Instructions keep changing. I'll be on Xarelto for 2 weeks, and then a full strength Ecotrin 325 milligrams. I'll be on that for another 2 weeks, and then I'll probably resume my baby aspirin, which I usually take every day. Obviously, I'm going to be moving my ankle and calves and contracting my calves because it's real important to keep the blood flowing. I talked about the leg swelling, and I've actually been watching a video of, I guess it's Murray, who's 5 days after surgery right now down in Sydney, Australia, and he's on YouTube also, but I didn't see any mention of his supplying ice packs, and I actually bought this ice machine that the person, the orthopedic supply company that in his office will come by. It was $150, and I know it's money well spent, and during this surgery or after the surgery it'll be wrapped around my leg, the actual, I guess it's a bladder that has a tubing hook, and this tubing will hook up to the machine, which will circulate ice water actually. The machine's set up to put ice and water into it so it'll circulate, but actually the best advice is take some water bottles, empty it a bit. It'll hold 6 water bottles, so you keep 6 in the freezer and replace that with the 6 that are in there, and you have some water and it could circulate, and you can control the temperature, and you use that during the daytime. We'll see more of that, I guess, after the surgery, but that should keep the swelling down, which is going to be important, and obviously keeping leg elevation. Range of motion exercises will be done the first couple of weeks, and we'll go through that later as I actually proceed. I do have a walker, and I know the walker is going to be important, basically to slow me down, even though I'm sure I'm going to be needing it to be non-weight bearing. I think typically it's for about 2 to 3 weeks. We'll see how it goes, just to keep the weight off that and just relearning how to walk. I think that's most important. I think most patients probably feel better and the surgeons feel comfortable telling people that you need to slow down and let your body heal. The most important time that I see, that because there are different phases, the first 2 weeks is making sure the wound heals, no infection, and swelling goes down, and that's the first phase. The next will be through the first 6 weeks when the capsule, that's the soft tissue surrounding the joint, that needs to heal up. Once the capsule's healed up after 6 weeks, and then more range of motion and stretching can be performed, because that's going to be important as far as maintaining mobility. So, first 6 weeks I think is going to be the most critical. So I personally am not worried about the surgery. I'm more concerned about the rehab, in particular the first 6 weeks. And obviously, anyone who's been doing research on hip resurfacing, you know that the major concerns, besides what I talked about with them, would be femoral neck fracture, which can occur most frequently in the first year, but the femoral neck is probably the weakest between 3 and 6 months. It's a delayed reaction of the bone where it loses the calcium, but at the end of a year there's actually more calcium and bone deposition in the femoral neck than there is prior to the surgery. So the risk of fracture is really diminished. And as long as the femoral head prosthesis that's put in, which I'm expecting to be greater than 50 millimeters, the risk of dislocation is pretty slim. And you just have to take standard precautions. I was amused when I spoke to Dr. Redham about hip precautions. He told me he had 3 patients that had a dislocation, and he said the first one, well, he was drunk and fell off a bar stool, and then there's another woman who about 4 weeks after that, she slipped on the floor and fell down, and that caused a dislocation. And then the third, and he said, well, he was actually drunk also. So obviously it could happen, but people can contribute to their own mishaps. All right, that's it for now. I'll see if there's anything else I can remember tomorrow, which will be the day before the surgery.